Perspective on Florida Gateway College Television is sponsored by Nutrien. Nutrien, feeding the future.
Hello everyone and welcome to Perspective. This is a public affairs presentation of Florida Gateway College. My name is Mike McKee and my guests on the program today represent the emergency medical services here at Florida Gateway College. We have Ann Brown, who is the EMS Program Coordinator, Ariel Tu, who's a paramedic student, and Jensen Stewart. That's not to be confused with Justin Stewart. Jensen Stewart is also an EMT firefighter student here at Florida Gateway College. We're going to talk about how to get in the program, what type of jobs are available, and what kind of wages you can earn in this program. We'll do that when we come back. Don't go away.
Are your children in the right car seat for their age and size? Is the seat supposed to be forward-facing or rear-facing? Did they move to a booster seat too soon? It may be too late to check when you're on the road. Fortunately, you're on the couch. Car crashes are a leading killer of children 1 to 13. Don't think you know. Know you know.
Welcome back to Perspective on Florida Gateway College Television. That kind of hits home what you guys do when you see a car accident that you're really not expecting. And I know, Ann, you saw it, you went, oh my gosh, that was pretty wild. But this is your business. So talk a little bit about EMT, paramedic, firefighter training that goes on at our Lusty campus here for Florida Gateway College.
Okay, well, we have the privilege of being able to, or the luxury, I guess, of being able to offer the EMT, the paramedic, and the fire all at one campus. And so the programs really kind of feed each other because you don't have to be a firefighter to be a paramedic. You don't have to be a paramedic to be a firefighter, but they do lend well to each other, and so the programs kind of feed each other.
Well, let's talk about so the basic is a firefighter. That's like a 9-month course.
1 semester.
4-month course, and that can lead to paramedic. Talk about the progression. Because you've got a couple young people here who are in the middle of that progression.
We do.
We're going to talk to them about why they decided to get in the program. But how does that go? How do you start with firefighter, or can you
actually start with EMT? You can start with firefighter, but that's not the traditional. So start with EMT, and we have an EMT firefighter combined program. And the only purpose really of doing that is to enable fire to be eligible for financial aid. So the EMT is the basic level course, and then you can take the firefighter route, or you could stop right there and get a job and work, or you could go on and get your paramedic. You can go on after that to get an associate in science degree, and then those you can even later go on to be a nursing. A lot of paramedics go on to be PAs, even physicians. So anything in the healthcare field is in that direction. And then the firefighter, if most EMS agencies are fire and EMS combined, but not all. Gainesville, for example, while they do have paramedic firefighters, is a fire department. Century Ambulance Service, for example, that provides the 911 response to Columbia County, that's an EMS agency. You don't need to have a fire credential. So, and then there's places like Jacksonville Fire Rescue where you have to have both. So it really kind of depends on what agency you want to work at as to what credential you need.
Well, and the beauty, I guess, of the program is you can pretty much figure out what you want to do and what you're comfortable doing by getting into like the first set of courses.
Yes, and for example, EMT is 1 semester. At the end of EMT, you can go, yep, this isn't what I thought, this isn't for me, and choose to go do something else, and you've invested 1 semester. Flip side of that, if you're like, oh yes, I definitely love this, this is what I want to do with my life, then you can progress on. Or if you're like, I'm just really happy being an EMT, I'm okay being at this level, and stay right there, get a job, and work as an EMT for the rest of your career.
Let me ask someone who is in that training, Jensen, is this what you wanted to do? Was this a calling you had, or did you see Chicago Fire on TV, or I mean, what was it that said to Jensen that this might be a pretty cool thing to do?
So Originally, I wasn't going to get into public safety. The main goal was to go to a big university, get a 4-year degree, and be the doctor everybody sees on TV. And after learning the hard way, it doesn't really work out like that. I knew I wanted to be in some type of medicine, some type of public safety, so I could help people. That's my main goal out of all this. And didn't really know what I was going to do when I heard about Florida Gateway College and how great of an EMS program they had. And after I went to orientation, met a few of the instructors, I knew that's where I wanted to be. I knew that was the best program for me.
Okay, have you seen any blood and guts yet? I mean, and again, I'm sure that if you, and I'm going to be serious.
That's why we're here.
Well, if you kind of flinch when you see you cut yourself and you're like, oh Lord, that's probably not going to be good for you, right?
All right. So personally, I haven't gotten to see anything too gory yet.
But you think it'll bother you, or?
Not really. I've seen some stuff that I know that just doesn't faze me, and you kind of got to turn that off. It's a switch you got to flip to be able to work in this profession. At the end of the day, emotion has to be kind of phased out when you're on the scene.
And let me ask about that. Is that part of the training that you have to sit aside? I mean, the public service announcement we saw at the beginning of this was about children dying in car accidents. How much of that emotion has to be turned off when you're, and what, is that taught in the class?
Coping mechanisms are taught in the class. So turning off an emotion is difficult, and it's almost kind of a self-preservation mechanism that we have. So a lot of people can kind of flip that switch, as Jensen said, and if you can do that, that's fantastic. If you can't do that, that's also okay, but you have to have the coping mechanisms in place. And we're seeing more and more in the news about PTSD from EMS professionals who unfortunately are committing suicide and really having a hard time with it. And it used to be a case of we didn't talk about those things. It wasn't cool to need help. It was kind of a macho profession, and now when you see the things that these guys do day in and day out, it's going to take a toll, especially when you're dealing with children or, heaven forbid, it's someone you know that you have to respond to. So it can be difficult, and knowing having those coping mechanisms for what to do in those situations, that is for sure taught.
Ariel, as a female in this profession, there's not a lot of female, or maybe there are a lot of females in this profession, but what made you decide that this is what you wanted to do? And you're a paramedic student, right?
Yes. I've actually been in the field for 4 years now. 2014 is when I got my EMT license, and I've been working since then. But I always had that will and want to save lives and help people. And it is a very male-dominant profession, but I kind of feel very empowered being a female in this kind of job, basically. And it's like what you were talking about the other day, or a little bit ago, about coping mechanisms. It's very, very difficult to sometimes turn that off. But I think once you've been in the job for as long as you have, you just learn better ways to deal with those situations.
Now you've been in the field for 4 years, so you've been an EMT. Mm-hmm. Now, so what's the difference between the EMT and, say, where you are now in the paramedic program?
So when I graduate and I pass my boards, we do like advanced pharmacological skills, which is like being able to push drugs. Also advanced airway management, which is also basically like being able to intubate, breathe for someone, basically. And just, of course, it's an extra year of schooling. But other than that, you always want to go to your basic life support regardless. It's always about airway, breathing, and circulation no matter what. So regardless if you're a paramedic or an EMT, you still have a very, very important role.
Let's talk about the fact that you've been in this field for 4 years. What's tough about it? I mean, is it getting call and getting a little adrenaline rush, because I'm sure you do, because you don't know, I mean, you honestly don't know what you're going to go to. You may hear a little bit on the radio about where you're going, but what is it, the unexpected and not knowing and having to kind of look at things and say, what do we do? How are we going to attack this?
So in this job, the adrenaline is unreal. Agreed about that, but you have to kind of be an adrenaline junkie in order to even do this job, because you really don't know. It's a very blind job. Dispatch sometimes doesn't get the information that they need, and they can't give that to you. So you walk into many scenes very unknown. You have no idea. But the hardest part is probably being able to incorporate your everyday life with your job, because it is completely different. You have to be a completely different person when you're at work, and how, like they say, don't bring your work home. That can be very difficult too. That's probably one of the worst parts about the job, is just having to try to separate life from work. But in most EMS people's minds, I guess you can say, life, like work is life. It's one of those things, it becomes a part of you. And it's a pretty special thing. But if you get into it and it's not something that you feel very passionate about, you need to get out of it, because it becomes your life, and it's very exciting.
Now, Jensen, you're again new to this, and so you've not been out. And have you done a ride along yet with EMT?
Yes, sir. I've actually had 5 field shifts and 3 hospital clinicals.
No, okay, so describe that. I mean, when you're riding along and you're in the station, so to speak, and you get that call and you actually go out on a call, what's that like, maybe for you as a young guy?
For me, it's like you said, it's an adrenaline rush. Sudden, you don't really know what you're going to. You have no way of knowing besides what dispatch tells you. But you got to run your emotion. Don't let your emotion run you. So when you get that initial adrenaline rush, you have to be able to use it to your advantage. Let it help you tune your skills rather than just go haywire and not forget what you have to do on that call. Let's
talk about that. You're probably to the point in your training where a lot of this has got to be second nature, right? That you can't be thinking about. It just becomes part of what you do, right?
So for me, it's more or less, I have a bunch of options going on in my mind. Like when I get the call, if it's a respiratory distress, I have 2 or 3 different options as to what I might have to do. And like you said, a bunch of it is second nature. You know what you have to do when a certain situation presents itself.
All right, we're talking about emergency medical services training here at Florida Gateway College, and you're watching us on FGC TV, and perhaps you're actually watching us on YouTube where the show is stored. But we're also on 2 local radio stations, WCJX and WQHL Radio, and we welcome and thank the listeners who are listening to this program via radio today, probably in their car, thinking about not getting into an accident. We're going to talk more with these young people and with Ann Brown in that program. When we come back, don't go away. You're watching Perspective on FGC TV.
Hey, Bobo, do trees tell each other stories?
I'm sorry. I'm afraid I don't know that.
Hey, why don't we go find out? Listen.
Can birds draw pictures?
I don't have an answer for that.
Dad, do stars visit their friends?
Look!
Welcome back to Perspective here on Florida Gateway College Television. My guests are all part of the Emergency Medical Services Training Program here at Florida Gateway College, which is done at our Olustee site, which is in Baker County, but it's not too far away. It's 8 miles from the actual college campus. And it's really kind of neat to have all these like-minded students in one area on a campus that is pretty much your own, really.
It is.
Richie went out, our producer, director, jack of all trades, went out and shot some video of the training, and I wanted to show this to, obviously the radio viewers or radio listeners can't see this, but we're going to describe, this is a first year program?
These are the EMT basic students. So these guys have been in the program at this point right about 3 months. Here they're practicing airway management. Unfortunately, that's not something we let them practice on each other. It just wouldn't be nice. So we use a simulator.
Well, so you've got something sticking down into their throat, right?
Yes, that's an oral airway, and so that's all of the equipment they're using is real, but the mannequins, we try to make it as realistic as possible, so they're using a mannequin.
It would be hard to find a distressed person to say, "Can we practice on you?"
Can we put this? Yes.
These are pretty lifelike, right?
Lifelike as we can get it. Yes, they move a little stiffer than a
Well, and you're
live
not
person.
When someone's having this done to them, they're probably not in the best mood.
They're not.
So
they're not.
You've got to kind of assume what a patient is going to be doing. I mean,
right.
That's also part of the training, is it not?
It is, and once they've been signed off on any, for example, they were doing airway management. Now, when they go out into the field in the hospital, they do once they've been signed off on any given skill. Once they go out into their clinicals, they do perform those on real life people in distress. So
and this is part of the clinical. These are all the remote type units that I guess that's heart monitor.
Heart monitor. Mm-hmm.
And here's some of the drugs.
The drug box. Yep. Now the EMT students are responsible for 8 drugs. Paramedics, on the other hand, are responsible for 108 drugs. So that's kind of a little bit of the difference in training. This mannequin that you're seeing here is great. I don't know if you noticed right before.
It looked like it was breathing.
He's breathing. He blinks. He breathes. He has a blood pressure. He has veins. He has pulses.
So this is pretty
This
lifelike.
one's more lifelike. Yes. We can even talk. We don't very often because it's a little labor intensive, but he can actually talk.
Here's the proper way to put someone on, and this is actually a live person.
This is another student. So some of they actually they do IVs on each other. They backboard each other. I don't want them going into a hospital and on a sick person say, "This is the first IV I've ever started." So they do IVs on each other.
Well, and I can imagine if you're going to have this done to you, you want to know what that feels like to a real patient.
Yes.
Especially, you think about, this is not the finest time for anyone who's needing, and you shaking your head, Ariel. What these people are hurting. 9 times out of 10, you're in some sort of distress where you're either been shot, mm-hmm. you've been in a very traumatic automobile accident, you've maybe been in a fire where you've been burned, you've taken a fall. So they're not in their best mood. So how difficult is that? You got to have kind of a calming nature about yourself, right?
Absolutely. You get the unfortunate luxury of being with someone on their worst day. So basically, you have to be their saving grace, you have to be their comforter, you have to also be competent in what you do and knowledgeable, and you have to be so sensitive to the fact that this is a traumatic experience for them, no matter what it is, no matter what they're doing, no matter what happened. You have to treat everyone exactly the same. And sometimes that gets a little difficult because there are some patients that are a little bit maybe angry, and you have to kind of step back and be like, this is not my emergency, this is theirs. And this is how I'm going to assess it and take care of it.
Well, and they may say some things that, and that has to be part, Jensen, you're smiling over there. I'm sure that there are people out there that are angry that they're in this situation, and so they're angry, they're maybe lashing out at you. Is that something you have to overcome as a student?
The biggest thing when you're dealing with somebody and it's their emergency, they're not really worried about common courtesy. So you're gonna get some anger, you're gonna get some rudeness, and you have to be able to not take it personally, because at the end of the day, they're not coming at you in a personal manner. They're just mad at the situation overall.
Well, and Ariel, again, you've been in this longer than Jensen has. Some people don't know whether they're going to live or not. And how difficult is that to cope with? Because here you are, a student. You know what you're doing. You know what it's going to take, but even you don't know whether there's going to be a good result.
So I feel like as long as you do what you were trained to do and you follow the set of protocols that have been set out for you, and you feel morally that you have done everything that you could possibly do, that the outcome is always going to be what it's supposed to be. So it is difficult to know that walking onto any scene, it might be this person's last day on this earth. That is a very difficult part, but that's another part of EMS where you have to kind of almost shut that off, because you have to do what you can do, but if that's not enough, you have to be okay with that. You have to be able to understand and cope with that.
And when you see these two young people here that kind of have a handle on the way things are, and is that the type of person that you need in this program? Because I look at someone who may be emotionally fragile, that maybe cry a lot, that this might not be their cup of tea.
Yes, and that's one of the things we try and figure out throughout the program, and sometimes that does happen. And the flip side of that is equally true. If you have no empathetic skills, or some folks have no filter, this job isn't for everyone, and trying to figure out who those people are that should be in the field is part of what we do.
My wife worked in the hospital for 30 years, and there was a doctor that would say a woman was complaining about the care she was getting in the hospital, and the doctor turned to her without thinking of it and said, "This ain't no hotel." And it basically came out like that. So you got to have a little more empathy for a patient who may not be doing really good and maybe be in the worst day of their life, and those skills are taught as well. But you kind of have to have that to begin with.
It's one of the things you really kind of have to come in with, and figuring out whether or not people have that is our job as faculty.
All right, Jensen, let's talk about the rigor of this program. And when you first decided to go into it, were you a little scared that you wouldn't be able to do the coursework? Well, and I'm not saying that, just human nature is to kind of not know what you're going to be doing. How did you get over that? Because you obviously are in the program and have done pretty well.
So honestly, coming into the program, I was nervous. I was afraid I wasn't going to be able to hack it.
Well, you don't want to fail, right?
Right. You don't never want to get a bad grade. I mean, who's going to post that on the fridge? That's not. you don't want a bad grade. But the instructors, they present the material in a way where for me, it just kind of flows. It's not. It's very labor intensive, don't get me wrong, and you have to put in the work to study, but hearing these instructors put it in real life perspective, it really makes it just flow in a way that I can't describe. It's amazing.
Well, and Ann, if there are some young people out there that are looking at this or hearing this on the radio, or if there's a parent out there that says, my kid is kind of into, maybe this would be a good career for them, what things should they be doing while they're in high school now? Is math important? I mean, obviously measurements of if you're going to do an IV at some point. What types of things do they need to be good at, or at least do well in while they're in high school?
This is typically a science type of program. So if you're great at your anatomy and physiology, math does play a component. Reading and comprehension, because so much of it, the book is literally this thick, and if we could tell you everything you have to know, that would be great, but you do have to do some self-learning, so reading and comprehension is important. One of the biggest things you need to do in high school is stay out of trouble. You have to pass a background check, you have to pass a drug screen, you have to be physically fit. So those are probably at least as important as the academic side.
Well, and just so that the people out there know, you're not just going to take someone off the street. You're going to have a good, solid citizzen that is going to be trusted with drugs to administer to patients. That is going to have to. I mean, you're going to have to be confidential, right? I mean, you have to keep what you hear confidential because of I guess there's HIPAA rules that are
sure. Yep.
And so that has to be taught as well.
Yes, that is.
And so they have to understand that as well. Other things, and you mentioned anatomy and physiology. That's kind of a tough class. But if you love what you're doing, Ariel's shaking her head, it's easy, right? I mean, basic where things are, where your organs are?
Absolutely. And I mean, exactly what you said. If you love what you're doing, it's not a job, it's not school, it's not hard if you love something that you're doing. It's not.
Well, and again, you learn stuff about yourself too.
Absolutely.
Jensen, tell me, when you learn about anatomy and physiology, not that you're going to self-diagnose or anything, but if you get a pain in your leg, you say, well, you know, that could be, has it helped you in your personal life?
Yeah, it definitely does. You do get where you kind of self-diagnose. Not that I'm a doctor or even a paramedic where I can do it in depth, but yeah, it's nice to know the basic stuff, like basic signs of a heart attack, basic signs like that. That way, if I see my grandmother's having chest pain, I can kind of like, okay, it's not a heart attack. It's just got a little exhausted. It's fine.
We need to get you to the hospital, or
right.
You're just got a little bit of indigestion
right.
from a big turkey dinner. And so you recommend that students try to keep B average. I mean, you accept.
We actually, C average will even work. I'd
you-
rather have my B student.
Yeah,
If I can
B
get the A student, that's great. But it's really funny, the folks with the C kind of average, the people that traditionally go into this field are doers. So it's the hands-on learners. So a lot of times you can get a student who's not great academically who comes in and really kills it in this program because of the type of program it is.
Well, we're going to take one last break and then give you some information on how you can enroll in this program or any of the EMS programs that we have here at Florida Gateway College. We'll do that when we come back. Don't go away.
Not completing high school is more of a social thing than it was an academic thing. Even though all these years have passed, I still had that longing to have my diploma. I have a mentor, and she convinced me to continue my education.
No one receives a diploma alone.
If you're even considering getting your high school diploma, go get it. You can do it.
Find free adult education classes near you at finishyourdiploma.org.
Active on Florida Gateway College Television. EMS programs at Florida Gateway College have been the topic today. And if a student out there, I mean, you can be an older student. I mean, you don't have to necessarily be right out of high school. But if you want a second career or maybe a part-time job, or maybe this is not something you want to do in retirement, but how do people get more information on the program?
And you're right, I've got a guy in his 60s in my EMT class right now, so it happens. So the way to get in touch with me, my email, ann.brown@fgc.edu is probably the easiest. My office line is 386-754-4292, and I would be your advisor to get you through the admission process.
Well, and if someone was a little apprehensive about the program, you could have them come out and take a look at what you got.
Come out, do a tour.
Kind of look at what maybe what we showed today here.
Absolutely.
Well, guys, congratulations on the success that you're having here at Florida Gateway College, and I hope that if I'm in an unfortunate accident, that one of you guys is taking care of me, and I promise not to cuss at you. And thank you for being here. Thank you for watching Perspective on Florida Gateway College Television. Until next time, I'm Mike McKee. So long.